Medicare's had its problems over the years. From the very beginning, it's had problems with overpayments on certain procedures, underpayments on others, and Congress has tried passing price controls to address that and bring costs under control. It still hasn't happened. So along comes Obamacare, and Obamacare says, well, we've got to bring these costs under control further, especially because when you look at the cost of the Obamacare bill, the Affordable Care Act, its costs are going to be astronomical. So one way to make it look lower is to say, oh, we're going to save all this money on Medicare to kind of offset the extra spending we're going to have on Obamacare. So a couple of the ways that they did that were by imposing certain conditions. One of them is called accountable care organizations, and that is where hospitals and doctors band together and they agree to be responsible for caring for 5,000 or more Medicare patients. This whole group of hospitals is taking care of that. But what they have to do to be an accountable care organization is to try to reduce Medicare spending on those patients. Well, you know what that means, right? We're going to get less care, or people that need it aren't going to get it, and so on. And at the same time, you're consolidating the healthcare sector, which reduces the number of independent physicians, makes everybody into these big conglomerates, which is less personal, more bureaucratic, and also easier for the government to control. You know, they have a cozy relationship with a lot of big corporations, whether it's in the healthcare sector or not, so it makes it easier to control. And they do want, by the way, everybody in Medicare ultimately to be in an accountable care organization. Probably even worse than the accountable care organizations or the Independent Payment Advisory Board. And this is the one that people have called the death panel, and there's a good reason for that. This board is going to look at projected Medicare spending for a year, and if it's beyond certain targets, they're going to recommend cuts. And those cuts could make care either impossible to, or they'll just say we're not going to pay for this at all, or they'll set the reimbursement so low that doctors and hospitals can't afford to do it. The board is a presidential commission. Now they get confirmed by the Senate. And Congress has the ability to override them, but it's very limited. It has to be in a certain amount of time, and it has to have its own corresponding cuts in it. So it's something that's unlikely to happen, especially because if it doesn't happen, Congress can say, well, hey, it's not our fault that these kind of cuts went in, so don't blame us. The other interesting thing about IPAB, and now this is likely, if somebody took this to court, it's likely that the courts would say this is unconstitutional, but according to the Affordable Care Act, Congress has a very limited time frame in which it can repeal IPAB, and there are very strict conditions about that. It's only during a brief period in 2017 that it can be repealed. After that, you're stuck with it forever. So all of those things may reduce Medicare costs, but they're also going to reduce care. And one more thing the administration is doing, which isn't necessarily part of Obamacare, but they're trying to encourage doctors to talk to patients about end-of-life care and when they would like to have it cut off. And I don't think that's really the way we want healthcare to go, but that's usually the way socialist government-run healthcare ends up. You know, look at England or any other place that has that. Eventually, the elderly are the ones that are costing the most money, and they're the ones where you say, well, you know, sure, we spend $10,000 on this procedure and this person might live for 5 more years. Is it really worth it? Well, then care gets rationed and people get euthanized, and that's where we have that problem. So what do? Well, government approach isn't working. We did at one time have a relatively free market in healthcare in this country, and we could get there again. And at that time, people didn't have trouble paying for it because the cost was a lot lower. Since the government has gotten involved, healthcare costs have skyrocketed. Since Medicare went into effect, healthcare costs have gone up about 9-fold. So a lot of that has to do with increasing demand, because if you're not paying for your own healthcare, somebody else is paying for it. You'll use more of it, just like anything else that you're getting paid, somebody else is paying for. So a free market is what we need. You got to get rid of Obamacare, but you need to get rid of Medicare and Medicaid and all these other things at the federal level and really at the state and even local level that interfere with patient, who should be the customer, getting together with the doctor or the hospital, who should be the supplier, and saying, here's what I need, and they come to an agreement on price, you come to an agreement on all the other things voluntarily. You get the care you want at a price you can afford, and if you can't afford it, doctors and hospitals, as they did before Medicare and Medicaid came along, will treat people in need for free or at reduced cost. There will be charities that can help out. There are already plenty of charities that help with a lot of healthcare things, and generally speaking, you would have good quality care, and it would be affordable without all these interventions and political manipulation.